Meet Nate Quarry, former professional mixed martial arts fighter with numerous wins under his belt. But his story is more than just grappling on the mat. As a contender in the octagon, Nate finally met his ultimate opponent.
I had just fought for the world title in the UFC, fighting for the middleweight championship, and just 3 months after that, I couldn't pick up my little girl. She was about 5 years old at the time, and my back was just hurting too badly. And so I did what all patients do. I went to the doctor, and he diagnosed me with degenerative disc disease. And my lumbar spine at L23 had just completely degenerated away, and I had bone-on-bone grinding. And when he gave me the news that I needed a spinal fusion surgery, it was the most terrifying news I could have ever imagined. I went out into the parking lot and just broke down crying. I was so scared.
Dr. Fogel, San Antonio's premier orthopedic surgeon from Spine Pain Be Gone, explains the severity of Nate's condition.
It's uncommon to have as much trouble as Nate Quarry has at his young age, but like he likes to say, he had a lot of miles in the odometer, and it had actually turned over a couple of times in his case. So he had early wear related to trauma, injury, certainly getting thrown to the ground and then have someone headbutt into your gut is something that could mess up your back. He had a very bad injury that caused his disc to degenerate between L2 and L3 in his back. It's in his upper lumbar spine, not the usual level, a little higher than usual. He was so decimated by it he couldn't lift his little girl. He could not continue to practice and train as an MMA fighter. So he sought advice from a physician. The physician told him that, that level, the L2-3 level, was essentially shot, and that if he wanted to try and practice his craft again, if he wanted to get back in the ring and fight, he would have to have a fusion surgery, which is a way we make the bone stop hurting by stop moving.
Even though Nate had a chance for surgery, his outcome was not certain. Life without the ring, picking up his daughter, or life with endless back pain.
I knew if I didn't do anything where my road was going to go, and it was going to go absolutely nowhere. So I opted to get my surgery, even after being told by everyone I knew that if I get back surgery, my career is over, my life is over, I'll never pick up my little girl again, forget about ever returning to fighting.
However, an innovative procedure called X-Lift would give Nate a fighting chance.
In the old days, it was much harder to get back to activities because we would strip the muscle off the back to do the surgery, and that limited your recovery. These days, we leave the muscles intact. We use percutaneous screw techniques, and we use the X-Lift, which is the lateral approach that Nate had, to fix the back and allow it to fuse, and then you can get back to your usual activities.
I was up walking around the hospital within 24 hours, and at the 6-month mark I was cleared for full sparring, full activity, and I jumped back on the bike and made my way into the octagon again.
Nate came back with a bang.
15 months after my X-Lift, I was back fighting live on Spike TV for the UFC in a fight that became branded as the slugfest of the year, where I gave and took a beating and fortunately won in the 3rd round by knockout.
Nate is now an X-Lift patient ambassador that speaks around the country about his life-changing procedure.
My goal is really to educate patients out there. I'm not a doctor. I'm not going to recommend to anyone to get a procedure. I'm not going to give advice for what people can do, and I don't think they really want advice. They get advice from their doctor. What they're looking for is hope. Hope that this isn't the end for them, that they can get their life back, that they can play with their grandkids, they can work on their car, they can carry in the groceries, and just in case you want to take up cage fighting, well, it's on the table. I've done it after a spinal fusion surgery.